So this is Iris Martinez, an interviewer for the Iowa State University Special Collections and University Archives Voices of a Pandemic Oral History Project. Today is August 1st, 2021. I am interviewing Susana Martinez from Des Moines, Iowa. Please note, Susana, that this interview will be placed in the Iowa State University Library and shared with Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. If there is something you want to talk about, please bring it up and we'll talk about it.
Okay.
So, because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 5 questions. Please say yes, I agree, or no, I do not agree after each one. There are 2 questions we need to make sure you agree to before we go on. Voces wishes to archive your interview along with any other photographs and other documentation at the Parks Library at Iowa State University. We will retain copyright of the material you donate to Voces. So first question is, do you give Voces consent to archive your interview and your materials at the Parks Library?
Yes, I agree.
Okay. Question number 2, do you grant Voces copyright over the interview and any material you provide?
Yes, I agree.
Okay. And third question, do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Do I have to?
You don't have to.
No, I don't agree.
So we have many questions in a pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server. Before we send it to the Parks Library, we would have stripped out any contact information for yourself or your family members, so that will be a part of your public file. Your public file will only be accessible at the Parks Library. So question number 4 is, do you wish for us to share the rest of your interview in your public file available to the researchers at Parks Library?
Yes, I agree.
Okay, and the last question is, on occasion, Voices receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number and your email with journalists?
No.
Okay. Perfect. So we're just going to hop right into it. So let's just start by you telling me a little bit about your COVID experience.
I was working at a clinic when the pandemic hit, and we were furloughed for about 4 weeks. Was the idea that we would be furloughed, and I just wasn't able to not work for 4 weeks, so I ended up looking for a different type of employment during that time.
Mm-hmm.
I worked from home for about 6 months with the Iowa Department of Public Health. And then once the pandemic kind of lifted and slowed down at the beginning of 2021, I I was doing real estate this whole time. So from December 2019 through 2020 to January 2021, but I was just able to focus on real estate after 2021.
Okay, cool. So how did you first learn about COVID-19?
Again, I was working at the clinic, and so we were just listening to news reports from around the world and seeing other countries and how they shut down and how they were handling their situations in their own countries. And then I was just thinking that maybe it was something that would stay overseas,
Mm-hmm.
or it would just remain something that goes on the news that you just hear about. But of course, it hit everywhere and affected everyone. So.
Yeah. What was your initial reaction to the information about it?
One of the first countries that I remember being hit hard was Italy,
Yeah.
and I watched a lot of the interviews of these folks, being very scared and being um, very sad and scared because just so many people died so quickly in Italy, and they were posting that on the news, and like these people who didn't take it seriously, and their family members were passing away. So it just kind of hit really hard.
Yeah.
But at the same time, you just didn't know how to react because it wasn't happening here.
Exactly.
So, yeah.
So is that when you realized that it was serious, or do you think you had another
Yeah.
pivot moment?
No, it was definitely that was when I realized that it was very serious because it happened way too quickly. For you to ignore it is happening everywhere at the same time. There is no way to ignore it.
Exactly. So, what kind of daily impacts did COVID-19 have on you or your family or your neighbors?
So on me personally, it was a big just being at home.
Yeah.
That was obviously very new because I wasn't prepared to not be working. It was only for a short while for myself personally, it was only about a month, but it was just unreal. And then for my parents, it was very scary because they worked at Tyson Foods in Perry,
Mm-hmm.
and it was very evident that no precautions were being taken at the time.
Yeah.
And that there were so many people from the company getting sick, which is how my parents got sick. And so it was just kind of a slap in the face to know that like your parents are just they're just numbers, they're not people to these companies.
Yeah. I remember about the Tyson stories.
Yeah, they were pretty messed up.
Crazy. I have a lot of family members that work there too.
Mm.
So, how was going out into the world during COVID-19 different from pre-COVID?
I'm For me personally, I'm hyper aware of everything that I touch now.
Yeah.
Like I don't want to be touching things that multiple people have touched. I don't want to be going into public restrooms and touching handles and touching doorways or things like that. I think a lot more about how people used to be just so close together in crowded spaces all the time, and
Mm-hmm.
how now, even though the pandemic is kind of over, not really, or more people are vaccinated, they're just not taking these precautions seriously.
Yeah.
So that's kind of what I'm always thinking in the back of my head that, there still needs to be some space between me and the next person, at least, so that we can be comfortable and be safer.
Yeah. So, do you think it's going back to normal pre-COVID going outing since the restrictions are being lifted and people are being a little less lenient?
Um, it's hard to say. The restrictions are being lifted, and people are not, um, following the guidelines anymore.
Mm-hmm.
And it does feel like it's going back to normal. But at the same time, you see in the news that like cases are surging again,
Yeah.
especially in the in big populated areas like Florida and California. So I don't know. It's hard to say that things are going back to normal, but then what if it does start back up again?
Right. Right.
It's like a very weird if
Yeah.
period.
Something's coming.
Something's coming. Yeah, it's scary.
So, how did COVID impact your ability to gather with your family and friends during the times where, there was lockdowns?
Yeah, well, my husband's grandparents are both high risk. They're both diabetic, and one of them has had a stroke, and they're older, of course. So we didn't get to see them for about 2 or 3 months after the pandemic started. And they just lived like 10 minutes down the road.
Oh, wow.
So it was very, very hard on them. They felt very isolated. It was very sad is the word that I want to use.
Yeah.
Just it's so simple to go down the road,
Mm-hmm.
and we couldn't do that because we were scared that they could pass away.
Okay.
But yeah, phone calls helped a lot. Obviously, video calling, we did that with my family as well, with my sisters, with my parents, with the grandparents. Just tried to find other modes of communication so that we could still see each other's faces, especially.
Mm-hmm.
But for somebody who's older and who's never done that before, it felt like a punishment, is what they thought it was. It's just,
All
I
right.
can see you from very far away, but it's not going to be like a real interaction in their head.
Yeah.
So, but for myself and my husband, most of our friends are long distance. We have friends in Colorado, in Missouri, Illinois, Chicago, and San Diego at the time. So for us, this type of communication, we were already doing it.
Mm-hmm.
So it wasn't as big of an impact in terms of communicating with those friends.
Yeah. So, who did you get to interact with and why?
um, I think just my family.
Yeah.
And it was never all of us together at once. It was maybe I would see my parents one week, and maybe I would see my sisters another week.
Mm-hmm.
But we were trying to be. There was a good chunk of the summer where I didn't see my parents because that's when they were sick, and then I didn't see my sisters because they had seen my parents and they were afraid that they were sick. So the time that we didn't see each other just kept getting longer and longer and longer.
Yeah, yeah, yeah. I remember those days.
And eventually we were like, screw it, we have to see each other.
So, how did you feel about wearing the masks when the mandates came out?
Um, it was just a safety requirement to me. I have worked in places like, well, I've worked for cleaning companies. I've worked for like the clinic that I was at, and at women's shelters and a kid shelter. So wearing something like protective equipment. Oh, and I did work at Tyson too.
Right.
a long time ago. So like wearing protective equipment was nothing new. I figured it would be temporary, so I was just like, sure, why not? Put it on, do what you have to do, and then when you get home, you get to take it off.
Right.
But yeah, like it's been a year now, and it just keeps getting longer and longer and longer, and we just have to wear the mask.
So, how do you feel about the restriction being lifted and not super mandated anymore?
At the time, I thought it was okay. I'm seeing that some stores are putting their restrictions back on,
Hmm.
but at the time when the restrictions were lifted, I thought it was time for it to be done.
Right. Um, so let's jump into some education questions.
Mhm.
How did COVID change the way you or your community or your family receive education?
Let's see. I think I stopped watching the news pretty quickly, like from just regular TV,
Hmm.
because I could hear the misinformation and like the biases that were coming out. People weren't focusing on the virus being a virus and being dangerous to you as a person. They were focusing on political parties and this party versus that party instead of making restrictions or rules for the pandemic that would actually help. They were just like, well, this party said this, so we're going to do A, B, and C, and then they're attacking each other instead of actually addressing the problem.
Hmm.
So that's kind of why I stopped watching the news and I started following more closely the CDC's website, and I started following on social media like doctors and nurses who were on the front lines, and I would listen more to what they had to say because they were the ones dealing with it versus listening to the news while they were bickering with their
Hmm.
nonsense.
Yeah. So yeah, about that, how do you believe politics affected how COVID had been handled?
It definitely could have been handled better. Um, because that was last summer when we were in the middle of a pandemic and we were having all of these protests. Not that I'm against the protest. It was definitely something that needed to happen because for far too long these movements or the black folks had been shoved aside and their concerns had not been addressed for a very, very long time. And then it all culminated at the same time.
Yeah.
And instead of addressing one problem at a time, we had to deal with all of them at the same time. And neither of them got dealt with correctly. People still died in the pandemic and people still died in the Black Lives Matter movement. And that's not what was supposed to happen. That's not what the government should have been uh, addressing, I guess.
Right. So do you think the pandemic was a political tool?
No, I don't think it was a political tool. I just think that I guess I don't know. I don't think that the pandemic was released as a political tool, but they used it to scare people into voting or into voter suppression or
Hmm.
I don't know. There was so many things that happened last year.
Yeah. How do you think COVID affected the politics here in Iowa?
I think it divided us pretty good.
Oh.
I think a lot of people and a lot of friends who would normally be able to have a conversation about difficult topics stop speaking to each other because the differences in political views were just too far apart and too drastic to continue that type of relationship.
Hmm.
Um, Workplaces, especially, it was either for Trump or against Trump, and if you weren't for, then they were against you personally, and so it was just very weird to have that type of interactions in places where politics don't matter that much, like at work, for example.
Right. It's just like a hostile environment at one point.
It's a very hostile environment. And it was hostile even to the point to the where people who don't care about politics were also being attacked by people who do care about politics. And so there was just no middle ground, there was no neutral, there was no agreeing on anything. It's either you're with me or you're against me.
Right, right. So, was your education, any type of education, disrupted as a result of COVID-19, like moving online or anything?
Just work was online. Nothing, nothing more than usual, I guess.
Right, so how did COVID impact your work? I know you said you were furloughed at one point.
Yeah, so I was furloughed a little bit. Excuse me. I ended up quitting my job after we were furloughed, or during the time that we were furloughed, because I couldn't wait as much time as they were gonna keep us. I think it was 4 to 6 weeks, and I didn't want to wait 4 to 6 weeks to either get a paycheck or to find another job. So I just started looking immediately.
Right.
I had my real estate license starting in 2019, so I started doing real estate around the time that we got furloughed, kind of to keep myself busy
Yeah.
and to make sure that there wasn't like too much of a gap between one paycheck to the next paycheck. Um, but a lot of my real estate experience was in person. So I was in open houses. I was going to other people's homes. So I was always wearing a mask and I had hand sanitizer.
Hmm.
But if we could, if it was possible, we would try to do as many phone calls or as many virtual meetings as possible.
So, did at any point, do you have concerns about finances?
Yes. Yeah. Because I mean, folks who were looking for homes didn't want to move because they were scared, and that's understandable.
Hmm.
I knew one person personally who wanted to move to Texas at the time that the pandemic started, and she didn't put her house up for sale because she was afraid that her husband, or her kids could get sick if they went to Texas, because it was much more populated than Iowa. So, yeah, there's definitely business deals that didn't go through because people were scared to leave their homes.
Right. Yeah. That was just stuff. Um. So, did COVID impact your ability to financially contribute to your family at all?
In a way, yes.
No.
There was, like I said, missing paychecks here and there.
Right.
My husband was is working in construction, and so he was stable and an essential employee the whole time, so that was very helpful. But in terms of me and myself being able to contribute, it wasn't as consistent as I had previously been doing.
So, since your job was more people to people, was it harder to connect with them over like calls or like um FaceTime calls like this?
It depended on the person. There's some folks who are very adept at communicating virtually or through text or through email or any virtual communication they were okay with. Um, in my experience, it was mostly the older generations who didn't like only having phone calls or only having virtual meetings because they didn't seem to get like a real connection going,
Yeah,
where they just weren't able to. And so it really depended on the person who if they were able to put forth that effort or not.
I'm sure. I'm sure. So let's move on to some healthcare questions. So, what kind of concerns or questions about healthcare emerged as a result of COVID?
Well, healthcare access was probably the biggest. Um,
No, go ahead.
okay. Um, yeah, I think healthcare access was probably the biggest. You could see folks who were getting sick, and not like a little bit sick, like very, very ill
Mm.
and couldn't move out of their beds, or they were coughing, literally coughing up a lung. And they wouldn't go to the doctor because they knew that they couldn't afford the care.
Right.
And so that was very concerning for me, because how many people actually stayed in their homes a lot longer than they should have been, where they could have been to the doctor to prevent, maybe as much damage as was done to their body
Mm.
if they had gone in sooner. But so many people were terrified of how much it would cost to go to the doctor. And me being a real estate agent, I don't have insurance. If I had to go sign up with my husband's insurance, but for a minute there, I didn't have any, and I was scared that if I got sick, and I wasn't covered yet by his policy, how much money would that cost us? And even now, when I'm not working, how much more money would that cost?
Yeah.
So yeah, that for sure was, it's unnecessary to have to worry about financial support when your body is giving out on you.
Right. That's such a good point. So, how about any mental health impacts or challenges that you may have gone through during the pandemic or continue to?
Mentally, it was just adapting to, some working from home was hard. Um, Not easy to concentrate all the time. There's easily distracted, or um, it's just not a work friendly environment because I didn't think that I was going to be working from home, so I don't have things like a desk, a mouse, a comfortable chair to be in for 8 hours a day.
Yeah.
Just small things like that that you don't think about because you don't need them at home, but now that you're actually working at home, it's different. But mentally, just exhaustion, I think. Just listening to the news over and over again, and it's never anything good. It was always negative. Nothing bad, nothing good happened. Politics and all this just going on and on. Like it's just like a dumpster fire after a dumpster fire. It was terrible.
Right.
And then mental health wise, I don't know, just anxiety, like trying to figure out what's going to happen next.
Hmm.
Because there obviously wasn't like a real plan of action or like how are we going to handle this or make this situation better. So you're always kind of what's going to happen next, and you don't know which way to prepare for.
Right. So, do you think things are going back to normal regarding like work? Is work normal for you now?
Work is getting to be a lot better now. I can do open houses pretty much every weekend now, which feels, more normal.
Yeah.
And people are getting together again for birthday parties and baby showers and weddings. And so it does feel normal, but at the same time it's still nerve-wracking.
Right. Yeah. It feels like something's looming over us.
Right. Like we're not fully out.
All right. So, how do you feel about the vaccines or getting the vaccines?
I think people should get them. um I got mine as soon as it was available for my age group because again, my parents are also high risk and my husband's grandparents are high risk, and so we had just spent a year being apart so that we could not get them sick. And so being able to see them and all I had to do was go get a shot, then that was a no-brainer for me. Just go get it done and be on your way.
Right.
But yeah, I mean, of course, everybody was on the news of like it was made too quickly. Um, they don't know what the side effects are going to be, and that is a valid point. But me personally, as a female, and as a female on birth control, people would say things like, "Oh, you don't know what the side effects are going to be." Well, you don't know what the side effects are going to be when you're on birth control, but you still get birth control, don't you?
That's a good point.
And I get mad because the side effects for women on birth control are messed up. They're not like minor. It's like a huge hormonal change in your body. Like people gain weight, you get acne, like all of these things could happen, and there's still a possibility that you could still get pregnant. Well, it's the same thing with the vaccine. There's always a possibility that you could still get sick. That doesn't mean you have to go unprotected completely.
Right.
So that was my thing, is just get the dang thing. What's the worst that could happen?
That's a good comparison, though. um. So, I think I have touched on everything that I wanted to touch on, but one more thing. So how did the current or like the past social movements in conjunction with COVID-19 impact your daily life?
The social movements you said?
Yes.
I feel like just being hyper aware
Yeah.
of like everything that could happen or that has gone wrong. Um, because it was coming from every direction. That case with Vanessa Guillen,
Right.
like the people who you think are going to be protected are still not protected, right?
Mm-hmm.
Somebody who's in the military. And then there's people who obviously just, I don't know, at every turn there was something different. There was something even worse than the last thing. So just being hyper aware and like looking into news sources and trying to find like the positive, and then you literally can't find anything that's positive because I don't know. It was too much to take all in 1 year.
Right. As human as possible.
Yes, humanly possible. Without breaking down or I don't know. Yeah, it's just a lot.
So, did COVID impact your decisions on whether to participate in the protests 2020?
Yes.
Yes.
Yes, I did want to participate. Um, but no, I again, there's just too many people. Not everyone was respecting the regulations and rules towards masks and social distancing, and I had my immediate family to think of.
Right. So, what's your perspective on going out now?
I've been vaccinated. Most of my family has been vaccinated, so I feel a lot more comfortable. Obviously, like I said, there's still a possibility that you'd still get sick,
Uh-huh.
but I feel like I have done as much as I have can possibly do to do my part to keep myself and my family safe. So I feel a little bit more comfortable, but um, I don't know. I don't think that everyone is on the same page, and I think that's what makes it difficult to get back to normal.
Right. It makes the difference.
Hmm.
Yeah. Okay. So, I think I touched on everything. Is there anything else you would like to share with me about your experience with COVID-19 that I haven't asked you about?
I think we kind of covered everything.
Okay. Okay. I just want to thank you again for being a part of this project. We think it's really important that we have a space and a place for the Latino community to express their side of the story so that
Hmm.
way everyone else can get a greater appreciation for our experiences.
Hmm.
So thank you again, and I hope you have a great day.
Thank you. Appreciate your time.